Treatment guidelines are an attempt to provide not only standardization to our practice, but also to disseminate those standards to as many people as possible. Folks that might not have the experience that experts have taking care of particular problems, or who might not be able to keep up with some of the education and evidence base that is created each year. The problem with treatment guidelines is that they really are just that, guidelines. And if overinterpreted or interpreted too rigidly, they become an impediment to good practice, not to mention innovation. So the frontline practitioner has to wear many hats and has to keep up with quite a bit of information on just an almost unlimited number of conditions and therapies. So the guidelines offer an efficiency and a sense of economy, but when you use them, they're really incomplete. And that incompleteness puts us at risk for errors, because one of the things that frontline practitioners talk about is their lack of confidence in the guideline, how it was put together, how much it can be generalized to related conditions. And so they enter into the use of them with already a sense of being at risk and whether or not the guidelines will protect them or lead them astray. Well, I think that when we review the CDC guidelines and when we think about any decision that we make when it relates to policy, law, regulations, guidelines, we should always be thinking about what will be the unintended consequences of these actions. And if you stop and think for a bit, you realize that the real problem here was the lack of an evidence base on which to design those guidelines. And so I think what the CDC or anyone else should be asking is, before we put out guidelines, do we really have the information that we need to feel confident that these are the guidelines that we are going to release? And I think if you'd gone back and thought about that in more detail, that you would have seen that we really didn't have that evidence base. And that was what got us into trouble in the first place with the management of pain and the use of opioids, is that we had the opportunity prospectively to get that information and to see what happened to people who took these medications for as long as they did, and we wasted that opportunity. Now we're trying to play catch up, and we're trying to use the guidelines to rein in a practice that has already outpaced our knowledge base.